And, we have been visiting with Imperial County Chief Executive Officer Tony Rohodes for 5 months now, roughly. And joining Tony today, Imperial County Public Health Director Jeanette Angulo. And we're going to talk about, well, guess what? The COVID-19 pandemic and where we are, where we're going, what's happening, and what in the world is going to be next. Good morning, Tony. Good morning, Jeanette.
Good morning. Good morning. How are you doing, Carol?
We are doing well, thank you.
Good morning, Carol.
Good morning. You're both looking well-rested and ready to handle this, okay?
That's right.
Okay. Big news earlier in the week. Imperial County has been able to advance to stage 2. And we've been there before. Jeanette, you know, it was through most of the work in your department. We've hit the benchmarks, the criteria that the governor has set, and we're able to reopen the door just a crack. Give us a little bit of a background and an explanation here.
So let me just go back to that initial comment, and it hasn't been just public health, because this variance report, in order to be granted, we needed to meet a whole set of metrics and parameters, and hospitals had a huge piece in this, and they've been doing an awesome job with, capacity and, tending to the patients. And social services had a piece in there, and some of the other agencies that provide housing services, our skilled nursing facilities, and our community in general, because there's 2 metrics in there that had to do with testing positivity and case rates. So again, it was a whole collective effort. Public health can't take all the credit. We're part of the team. So yes, earlier in the week we shared some great news, and we had been our variance had been accepted. Therefore, we could move forward with some reopenings, with some modifications, because we're still on the data monitoring list. But let me tell you, there's going to be changes coming up, and not only changes to our roadmap to recovery metrics, and I'll explain in a little bit, but some additional changes that the state has been talking about.
I trust these are going to be positive changes.
Yes, let's look at everything in a positive manner. Yes.
Okay, and a long list of some of the businesses that can reopen with modifications. And if you have noticed on the YouTube channel, I am desperate for a haircut. Well, in talking to the young lady, Rosanna, who cuts my hair, she could open up outdoors. And not when it's 115 degrees. I'm sorry. That metric, those rules aren't going to apply for a while here. But, some of the other businesses, okay, you're able to open, but you're able to open for curbside. So, again, it is a small step, right?
It is a small positive step. And just today, our weather is much nicer in the morning. We just need to get creative for those businesses that can open outdoors. Yes, those the barber shops and some of the other businesses, maybe a little earlier, opening up a little earlier or operating a little later at night. So, yep, that's in the right direction.
You have to be flexible, adaptable, and be ready to jump in one direction or the other.
Correct. And it goes back to, personal responsibility, ensuring, that you are safe as a business owner, but not only that your customers are also safe, because let's remember, it's a small step forward, and our pandemic is not yet over, so we have to be overly cautious with what we do. What we don't want is to see huge increase in cases in the next 2, 3, 4 weeks that require us to take steps back. That's the last thing we want to do.
We've been there. We've done that. We don't want to do it again.
That is correct.
Okay. Tony, the county, how is the county adjusting for business? I know for the most part, a lot of departments, people working from home, or if you need to do business with a particular department, it is by appointment only. What adjustments is the county able to make?
So we're actually, that's something I'm going to be discussing with department heads early next week. Just trying to transition, and I guarantee you we will not be moving back to full capacity at any time soon. I think it's still going to be restrictive, similar to what you're seeing in restaurants and retail stores. We need to easily slow back into it because, they've talked about, second time around for COVID coming, and we really just don't want to have to add any stressors to the workplace or put people in a certain situation. We've been able to manage. I know it hasn't been ideal. I have reached out to various groups, working groups, real estate groups, some of the Rotaries and such, and I've asked, has this impeded any of their workload? And I think we got favorable responses back. I've offered to make adjustments as needed, and I think county staff is doing it. But there is some services that we do need to get back to offering, but I will tell you it will be restricted and not necessarily not letting people back into the building in full force, but maybe in a percentage ratio, allowing people to be able to come into the recorder's office and assessor's office, but only so many people at a time. Just something we need to do to also just continue to protect our workforce.
Okay. And Jeanette, you mentioned some changes on the horizon. What's coming down the road?
So, for example, many of us have been following the Roadmap to Recovery dashboard. And that dashboard was created because of the variance report. And those were the metrics we needed to meet. So now that our variance report has been accepted, modifications to those metrics need to be made to be aligned with our Imperial County triggers. So in the following days, you'll see some of the tabs being replaced with some additional tabs and some newer metrics related, again, to some of our triggers and some of our newer metrics that we've established for Imperial County. And for the community that hasn't had a chance to go on our website and look at our variance report that was submitted to the state of California, they can find it under the Roadmap to Recovery, and the website is www.icphd.org. And it's a whole document that talks about our situation and, the metrics that we met and some of the steps that we're taking moving forward.
Okay, now let's establish this. It is the state of California, the governor, through executive action, and the state public health department that have basically set these metrics, these guidelines, these goals that need to be met, right?
So for the variance report, yes. For some of the other metrics in the state's dashboards, yes. And we try to align as much as possible with the state so that we're comparing apples to apples. And if there's any question on our data, we're able to say, this is, what we're doing, and this is why we have a lower percentage, just like with what happened with our variance report. And they accepted that. So, yes, trying to align with the state.
Okay. And getting back to that dashboard, some days the numbers change dramatically. How current is the information? Okay, just as an example, over a 2-day period, the number of deaths spiked. Now, all those deaths did not occur in a 24-hour period, did they?
No, they did not. And that's a great question, Carol, because the Public Health Department is depending on others for certain pieces of information. You just brought up deaths. So that information, we have to wait for hospitals and others to report the information to us. And as I said in the past, sometimes this information, we don't get it until 2, 3, 4 weeks after they happen. So we tie those back to the date that the death actually happened in the timeline. But of course, you do see the big, reporting the higher number of deaths reported in a single day, but they're tied back to the actual date. The same with labs and positive case information. It's not an immediate turnaround that, the labs send the information. There may be a lag time, and it depends on each of the laboratories. But it's as current can be. And I do have to mention that if you take a look at the numbers that the state has for us compared to the numbers we have in our local dashboard, they're not going to match. We actually have more records than the state.
Okay. Has the state fixed their issues with collecting data, reporting data that they announced 2 or 3 weeks ago?
Per the state and an announcement that they made, yes. Now, I do just want to add, I want to go back to the cases locally. We do receive information via fax at times from our local hospitals and from others related to positive cases. And so those make it into our dashboard, but those are not reported through the state's CalReady system. So there needs to be an additional step and an additional data entry that needs to happen in order for the state to account for those. So that is part of the reason of why we have more records, because we get cases faxed in.
Okay. Now, you also told us last week the number of tracers, in effect investigators, has decreased dramatically. And the alternate care site at IVC has basically been deactivated. Are there any other changes?
So yes, some additional changes coming our way, and it has to do with contact tracers and investigators. So we've been working for weeks now with the federal government, Centers for Disease Control and Prevention, or CDC. And so what's going to happen is through the CDC Foundation, they've hired contact tracers and investigators, and we're working with the state to where the state tracers and investigators are going to transition out, about 20, but then CDC is going to transition in about 25. So we're going to get an additional support from CDC. It's just going to be a transition out for the state and a transition in for the CDC staff.
Okay, now this is an unfair question, but I'll ask it anyway. A lot of talk about a vaccine. And, certain people have promised a vaccine before the end of the year or possibly even sooner. Any idea where we stand on that?
Well, Jeanette hasn't promised any vaccine. So for us, a lot is still unknown, Carol. It would be unfair to give a date. We do know there's clinical trials, it's looking positive. But for me to give an exact date, it would be very unfair for our community. What we are, though, preparing for is the upcoming flu season. And so we do know and highly encourage, our community to go get a vaccine at pharmacies. Many of our pharmacies are already offering the flu vaccine. The Public Health Department usually gets its allocation of flu vaccine. This is state allocation, sometime late September, early October, and we usually have clinics in October, and this is for, the community in general. But we also provide part of that allocation to medical providers so that they can help us administer. So the vaccine that is coming is flu vaccine, and that'll be for the season. As far as the COVID-19 vaccine, I still don't have enough information, concrete information to share at this time.
Okay, how about testing?
COVID-19 testing, yes, still happening in Imperial County through the Optum Serve sites. And so because of the underutilization and the need in other counties, we are actually reducing one lane, and that'll be the Imperial lane. We will still have the lane in Calexico and in Brawley. And the Imperial lane will close its doors at the end of the day on Saturday. We'll still have the capacity to see 264 individuals per day, Tuesday through Saturday. And then our medical providers, our hospitals, they're doing a very nice job. They're also testing out in the community. So if it's not available through the Optum Serve sites, check in with the medical provider because they may be offering the COVID-19 diagnostic test.
And as you pointed out, pharmacists are permitted to administer the flu vaccine.
That is correct.
Okay. But not the COVID-19 vaccine because we don't have one yet.
Not to my knowledge. No, not in Imperial County yet.
Okay. Tony, let's change the subject a little bit. Let's look to Niland. What's new and exciting in Niland?
So actually, one of Jeanette's deputy directors, Jeff Lamore, he's actually up in Niland as we speak this morning, and they're conducting the last asbestos confirmation test on the last 4 properties. All the properties were cleared as of late Monday morning. Team Rubicon was teamed up with Imperial County, EFR, and Republic Services. It was a great team effort to get all the multiple properties cleared. The clearing has taken place. All the debris has been removed. There had to be initial asbestos tests done prior to the work being done, and there had to be confirmatory soil tests and asbestos tests done after all the properties were cleared. That's what's taking place today. Hopefully we'll have confirmation on those last 4 properties. So it was just a great project. It was a huge undertaking. The team really came together and has done a great job. The next stage will be talking to the residents, the property owners, and start working on how we can get things established back, utilities established back onto the properties where they need to be, and move forward to the next stage of longer-term housing possibilities.
Okay, and while we're on the subject of fires, what about the Imperial County Strike Team? Any word?
I talked to them a couple days ago. I try to keep in touch with them on a regular basis, sending them text or calling the captain on the engine. They are doing 24 hours on, 24 hours off. They have been keeping busy, and we got to keep them in our thoughts and prayers as they're out there throughout California.
Okay, Jeanette, did we miss anything?
No, I think we pretty much covered it. Changes, like I said, coming our way. For all of us that live in this community, just remember that the pandemic is still here. We still don't have a vaccine. We highly, highly encourage our community to keep on practicing those very healthy habits so, that we can keep ourselves and our loved ones safe and healthy.
Okay, and again, unfair question. When do we hit stage 3?
I have no idea.
Okay.
Well, hopefully in the very near future.
Okay, let's. If people stick to the guidelines, we've got a good chance of getting there.
Let's hope for as soon as possible.
Okay. We appreciate the visit today, and we look forward to moving forward on the roadmap to recovery, and let's get the economy open and moving in the right direction. Jeanette, Tony, both of you, have a great weekend.
You as well.
Thank you.
There's a lot going on right now, and broadcasters are on the ground covering all of it, bringing you the weather, the traffic, and breaking news, all while entertaining you 24 hours a day. Someone needs to tell you what's going on around the world and in our hometowns, and that someone is us. We are free radio. We are always there. We are broadcasters. Visit wearebroadcasters.com or text radio to 52886 to learn more. Furnished by NAB and this station.
The best oldies on the radio. AM 1230 KXO.